Welcome dancers, teachers and choreographers. We are here today to discuss and present to you the psychology of athletic injuries and how elite ballet dancers can overcome the psychological effects of injury. In addition, we will briefly discuss the common sites and causes of injury.
In ballet, there is in fact an injury known as the dancer's fracture. This exists at the proximal end of the fifth metatarsal and is due to an excessive weight bearing along the longitudinal arch of the foot. A complete break may occur if there is a sudden shift in weight from the medial to the lateral portion of the foot and is more prominent in female dancers as a result of point work.
Typically though, foot and ankle injuries are most common and more of a hindrance for obvious reasons. Confirming this information, a small questionnaire type study was performed using elite ballet dancers. 98% of dancers answered yes to having more than one injury in the time they have been a professional dancer. To break this down further, 31% of dancers reported having past ankle injuries, while 24 reported back, 15 hip, 12 with shoulder, and only 9 reported both knee and other types of injury. This proves consistent with previous literature in that ankle and foot injuries dominate other types of injury in dance.
The causes of injury may prove evident through intrinsic and extrinsic variables. Extrinsic variables include overwork, work dissatisfaction, floor surface, and/or perhaps shoe condition. One study reported that work satisfaction and not able to use one's full capacity were factors that increase the prevalence of incapacitation for work. Intrinsic factors relating to injury may include fatigue, muscle tension, life stress and anxiety, as well as age, personality, and social support. Social support is said to be one of the most common and important predictors of injury. A dancer's internal motivation strives towards perfectionism. However, sometimes to a point of being neurotic, which can lead to an injury. As ballet dancers have a higher than normal threshold of pain, they often avoid reporting an acute injury. They also have a tendency to return to work prematurely in the case of missing out on a role. To demonstrate this, a short interview on a professional ballet dancer will be shown. So I understand you have had this injury for quite some time. Is there a reason why you have avoided reporting it?
Yeah, I didn't want them to think that I couldn't do things, and I didn't want to miss out of being cast in some roles or going to Europe on tour.
Okay. Would you describe your injury a result of overuse?
I guess, yeah, initially that's what caused it.
And on a scale of 1 to 10, how would you describe the pain you experience when you dance?
Well, it's getting better now, but probably about 7 or something when I first had it.
Now that we have briefly discussed the common sites and causes of injury, the following section will present the psychological effects as well as coping mechanisms that ballet dancers can use to overcome injury. This can be done by simply changing the dancer's cognitive appraisal and modifying the physiological response by using the integrated model of psychological response to the sport and injury rehabilitation process. So firstly, let's define cognitive appraisal. According to Cox, cognitive appraisal is the thought processes of an athlete in a demanding situation which leads to the stress response and an actual injury. However, this will all depend on personal and situational factors like personality traits and easy access to health practitioners, physios, and sports psychologists. Based on the previous model, a cognitive appraisal will determine the emotional and behavioural response to the injury and rehabilitation process. Therefore, at the time of injury, it is important to determine the cognitive appraisal of the dancer. If immediately approached with a positive attitude, the dancer will recover sooner by regaining their hope, self-esteem, ability, and confidence. Again, it is also critical for the dancer to have a strong social support at this time. One study reported that peers, dance educators, dance companies, friends, choreographers, medical personnel, and loved ones can facilitate injury recovery by supporting the injured dancer. Research has on many occasions supported the fact that a positive cognitive appraisal has reported fewer injuries. Conversely, a negative cognitive process is said to lead to increased muscle tension, a narrowed focus, and increased distractibility. So the strategy here would be to redirect these factors by using relaxation techniques, meditation, imagery, self-talk, and affirmation statements. For example, take a few deep breaths from the abdomen and repeat, "I can maintain control over this situation," or imagine yourself in prime performance being watched by a large audience. This will, in effect, calm the sympathetic nervous system, decrease muscle tension and distractibility, and therefore redirect the attentional focus to recovery. It has been noted that a high ability to focus on a task results in fewer injuries.
We have now identified the cognitive appraisal of the dancer post-injury. However, emotionally, they will express negativity, feelings of helplessness, frustration, drops in self-esteem and confidence. In this case, research has proposed that by providing inventories immediately after the injury occurs helps determine the athlete's emotional response to recovery. Two of these inventories include the profile of mood states and the 28-question athletic coping skills inventory. Remember, cognitive appraisal determines emotional response, which determines behavioral response. Therefore, the final stage of the model is behavior, which reflects the dancer's adherence to the rehabilitation process. This may involve learning and changing the ways of previous muscle training, but coping with a positive attitude. Past literature has noted that an athlete with a high task mastery goal orientation proved more likely to adhere to rehabilitation than those with a low task orientation. In fact, dancers are highly task motivated, thus potentially have the ability to adhere to and approach the rehabilitation process willingly. However, contradicting this, another review suggests that ballet performers have low coping and cognitive skills and higher catastrophizing responses than recreational runners. Therefore, it appears important to initially determine the thought processes of the dancer in order to understand their emotional and behavioral response. In this case, the most important factor here would be social support.
To elaborate on our previously discussed coping mechanisms, others may include goal setting, positive learning benefits, and the use of biofeedback technology. For example, it has been reported that ballet dancers may relearn the correct technique by biofeedback machines, perhaps stretch more, or modify exercises which lead to the injury in the first place. Keeping a positive attitude and setting personal goals during the rehabilitation process will result in many benefits like personal growth, improved skill development, psychological skill enhancement, and improvements in physical health.
In summary, we have discussed the common sites and causes of injury in elite ballet dancers, as well as the psychological effects and coping mechanisms to positively adhere to and overcome an injury. We would like to thank you for listening and hope you have learned some important facts regarding the psychology of a dancer's injury and rehabilitation process.